Hello, Ariel. This is Dr. Adams, and I would like to welcome you to Module 2, which is covering medical terminology. In this lesson, we're going to build one of the most important foundational skills for your success as a sterile processing technician, and that's understanding the terminology of the healthcare field. So I think this might be a longer lecture, but feel free to pause and finish small parts of this lecture throughout the week, or if you want to move through it more swiftly all at one time, feel free to do that, and then just come back to it at your leisure. All right, let's get started. So let's start by providing a clear definition for the term medical terminology. So the simple question is, what is medical terminology? Well, let's explore that a little bit. And so the definition for medical terminology is that it is the specialized language, right, that is used by professionals in the healthcare field. And they use this language to help describe the human body, the medical procedures that people go to the hospital for, the instruments that are used, that the doctors and nurses use to do the surgical procedure, as well as the conditions. What is the problem with that patient health-wise? Do they have a virus? Do they have a cold, right? What is the condition that's bringing them there to the hospital? So in a simple term, you can think of medical terminology as the vocabulary of healthcare. So I want you to start to put on your healthcare hat, right? Because you're going to become a professional. So everything that we discuss in this unit, in this course, is going to be related to the healthcare field. You can also think of medical terminology as just the way that people within the healthcare field, again, at the doctor's office, at a major hospital or a clinic, the language they use to communicate to one another what needs to be done for the success of that patient. So this might seem like a lot, but the good news is that medical terminology follows a clear pattern that we can use to help us learn step by step how to break down these words and help us to remember them along the way. So we're going to get into some of that practice right now. So as a sterile processing technician, it's also important for you to understand that you will encounter medical terminology in many places in your daily work. So one place would be including like instrument names. You're going to need to understand the names of the different instruments that you will be using and preparing for the doctors and nurses who are going into the surgical procedure room. You will also need to understand the procedure list, right? So as a sterile processing technician, what do you need to do every day, right? So you need to make sure that these instruments are sterile. You need to label them. You might need to assemble them. You're going to need to disseminate them. And so you learned a little bit about the steps and the roles and responsibilities of a sterile processing technician during Module 1, right? So you need to understand the procedural list of things that you need to accomplish on a day-to-day basis. This terminology is also important because it's going to help you better understand the instruments that you will use to sterilize the instruments, right? So like this, I don't know the key name for it, but it's like looks like an oven, but I'm sure it's like a very sophisticated, high-powered dishwasher that's going to sterilize to make sure that there's no germs or viruses left on these instruments because they have to be reused. Another area that you will hear medical terminology is through the documentation that you will do. You might have to label these instruments and things of that nature. So these different terminologies that I will introduce in today's lesson will come up on a regular basis. And finally, you'll need to use the terminology to communicate information to the surgical team, the doctors and the nurses who are actually performing the surgery on the patient. They might ask you, are the instruments ready? Or they might ask for a particular instrument. And so you would need to know the name of that instrument to make sure that you're able to package it up and get it distributed to the right area for the surgical procedure. Okay, so I like to use pictures and analogies to help me understand key information. So I'm going to approach this lesson in the same way. And so, what I want you to know is that medical terminology, even though it can look intimidating at first, but most medical words follow, again, a predictable pattern. So we can think of medical terms like puzzles that can be taken apart and understood piece by piece. We can also put these puzzle pieces together to help us make meaning of the different words that we will be learning about as it relates to medical terminology. So, for this lesson, I just want you to know, take it easy. I don't want you to think that you have to memorize all of these words. It'll come to you over time. Right now, your goal is to learn how to break down the words, how to take them apart, and understand the different or the individual pieces. So, this is a skill that successful healthcare students develop, and then you'll be able to use it when you go into the workplace. Okay, so again, medical terminology is like puzzle pieces, and I'll show you how. Okay, so most medical terms are built from three main parts: the prefix of the word, which is the beginning of the word, the core of the word, which is the word, the part that gives it the main meaning, and the suffix, which is the ending of the word. So while most all medical terms or words will have these three parts, some of them may not, but for the majority of them, these are the three parts that they include. And so you may remember me telling you before, when you encounter a word and you don't know the meaning of a long word, I would always say, well, what is the root of the word? Look for the root, and that will typically give you a clue as to what the whole word means. And so that's how we're going to practice learning and better understanding medical terminology, or the vocabulary that you will be using when you go to work. Okay, let's just start again with the root, because that is really the most important part of the word. It gives you a clue as to what the whole word is about. The root usually tells us the main body part. So if you're thinking about the medical field, right, in your terminology, working as a healthcare professional, the root part of the word is going to talk about the body part or the core meaning, right? So think of the root as the what. And so some examples include, if you're thinking about the body part, the what, it could be the heart, which is referenced as cardio. The what of the body could be the skin of the body, which in medical terminology is considered the derm. And you can think about when you go to the dermatologist, they're going to look at your skin and treat your skin. Another example of a root word could be vein. In the healthcare field, they usually say ven. And then also a body part suggestion is glyc, which is known as sugar. And so when you're decoding a word, always try to find the root of the word first. And we're going to practice this. But again, root words could be heart, skin, vein, glyc, which is sugar. So it's the what of the body, right? What body part is being looked at, examined, or fixed by the doctor and the nurses. Okay, the prefix, before, right, comes at the beginning of the word. And so the prefix gives extra information about the root. So it's going to give you extra information about the body part. For example, extra information about the heart, or extra information about the skin, right? And so it often tells us, like, the location. Again, it's the heart. It could be the skin. It could be the foot. Or it'll tell us the amount or level, like how much work is being done. And again, we'll break some of this down. It'll tell us about the time of the body part. So again, we're not talking about time as in clock, but we're talking about time as in like before or after. And then the position, where on the body part is the doctor and the nurse going to concentrate their work on. So we can look at the prefix as an extra clue that tells us again about the body part. So some examples, prefix could be sub, right? So sub in medical terminology means under. So you can think about it like the submarine goes under the water. Intra is within, like enter. You're going to enter something. You're going to enter something. Hypo is low, and pre, again, is before. And so I'm just giving you some key definitions, and then I'm going to show you how we put all of this together. So just hang in there a little bit longer. The suffix comes at the end of the word. It's a part of the word at the end. And it usually tells us in the healthcare field what is happening, right? So it might describe the condition as to why the patient is at the doctor's office, the procedure the doctor is going to follow. It could reference the specialist or the doctor themselves or a disease, right? And so some examples, right, of what is happening could include like itis, and that's the medical term for inflammation. Or logist could be at the end of the word, and that's the specialist, like cardiologist, psychologist, right? So that's the specialist or the person who is specializing in the field. Emia is the end part of the word, and it means blood condition. And scope at the end of the word is an instrument used to look at something. So you can think about telescope. You're looking through the telescope to see something on the other end. In medical terminology, the scope is going to be something inserted into the body so that the doctor and the nurse can see what's going on. And again, I'm going to give you some examples of what this looks like. Okay, so I'm just going to pause, and I'm just going to let you know you got this. This is all new to you right now because you're learning how to be a professional in this field. So you're putting on a new hat, but I want you to know that you got this, right? And so I want you to know that every time you decode a medical word or term, right, your brain is getting stronger at understanding the language of healthcare. It might seem kind of weak right now because it's all new, but with everything else over time and with repetition, you're going to master this. Again, I don't need you to memorize everything. Your goal right now is really to learn the pattern of these words, the prefix, the root word, and the suffix. Hang in there, Ariel. You got this. And if this feels like a good time for you to pause, feel free to pause and just kind of let your brain take in this information before moving on. But I'll just keep going. Okay, so again, Ariel, every time you decode a word, the brain is getting stronger, and this skill is going to help you throughout your career as a sterile processing agent or personnel. So just take one word at a time and just know that you're building real professional knowledge. You're going to have a career, and so this is your professional knowledge. Again, just as an overview, the prefix is the beginning of the terminology, the beginning of the word is talking about the location within the body where this is going to happen, right? The heart, the skin, the number or the amount, how much it may be removed, and then the time. Is this pre, before, or post, after something? The root word is the body of the word or the what, again, the body part that we're referencing. And then the suffix is the end of the word, is the condition, maybe the virus, what are they coming in for, the procedure, and then the specialist or the person who's doing the actual procedure. Okay, so let's now apply what we've learned. Let's use the word perioperative, and it breaks down into three parts. Peri, which means around. Oper is surgery or the work. So think of operation. Again, just put your previous knowledge to these words. And then ative is just pertaining to something. So the beginning is around, and the middle is oper, which is operation or the work. And then ative is just relating to the operation. Oops, I'm sorry. Oops, it's not going to let me go back. I apologize, Ariel. It's not going to let me go back, but perioperative is like getting someone ready for an operation, right? So peri is before, oper is the operation. So it's just getting someone prepared for the operation. That's the term. So at this point, you might be asking, okay, this is a lot. So why is it important for me or you to know these terms if you're not going to be a doctor or a nurse. Well, you might one day decide you want to be a doctor or nurse, but we'll talk about that later. But to let you know, it's important because you will build your confidence and your self esteem as you work in the healthcare environment just by knowing these key terms. And so, as a sterile processing technician, you'll need to be able to read the names of the instruments that you'll be using. You'll need to be able to understand the procedure list, like what you need to do that day. Again, you're going to wash, you're going to clean these instruments, you're going to sterilize them. You might have to put labels on them. So you need to understand the terminology. You'll also be following written instructions, again, what needs to be done every day. You need to tell your coworkers, hey, that's such and such in that package, right? So you want to use the correct name. And then one day, if you want to, you might want to take a certification exam that will give you more qualifications and allow you to make more money in the field. But we don't have to think about certification exams right now. Right now, just be comfortable. We're just learning new information about the field. Okay, so let's practice a little more. Let's decode or take apart a few words, a few more words, so that you can see how the puzzle pieces fit together, right? So let's practice. Okay, so I'm going to allow you to practice on your own. So you can pause after I give instructions. So you can practice on your own. And then when you move to the next slide, I'll be on the next slide ready to give you more support with breaking down the key terminology. So we're going to start with the word subdermal, right? And so what I want you to do is break it into 3 parts, okay? So we hear the subdermal. Again, the first thing you will do is find the root word. So maybe write this down on a piece of paper. Subdermal, subdermal. So what is the root word? So the root word, again, is the middle. And it gives you the most information about the overall meaning, right? So what I want you to do is take a moment on your own, break down the word. Even if you don't know the meaning of it, it's okay. I'm going to help you on the next slide. So go ahead and pause. Write the word subdermal on a piece of paper and then break it down. What's the prefix? What's the root word? And what's the suffix? And if you have an indication as to what it means, like what does sub mean? What does derm mean? Then go ahead and tackle it. But otherwise, don't worry about it. Just break it down into the 3 parts. So go ahead and pause and do that. And then when you return to the video, I'll be on the next slide helping you to break it down. Okay, so hopefully you took an opportunity to break it down on your own. So let's do this together. Let's decode this word together. Subdermal. Sub, right? That's the prefix. That's the beginning part. Sub means under. Remember, a submarine goes under the water. Derm is skin. And again, you go to the dermatologist so they can look at your skin and treat whatever condition you have. And so the AL, the O at the end is just pertaining to the prefix and the root word. So subdermal has to do with treating something under the skin, right? So what are some examples of that? Well, you can look at this slide. The African child, there's something, and I know this is tribal and they do this on purpose, but it's still an example of subdermal. Like something took place underneath the skin for them to have that pattern that relates to their tribe. In the picture to the right, it looks like someone has a rash, right? But something happened underneath their skin for them to have this condition looking like this. That's why they probably went to the dermatologist to get some cream or ointment or something that's going to help them get rid of it. Like your eczema. Your eczema was flaring up. That's subdermal. Under the skin. You went to the doctor, they gave you some cream, or I don't know, maybe Marcia or Mashika gave you something. But anyway, you get treated for that condition. So the condition is like a rash, right? But subdermal, sub, under, derm, skin. Okay, let's try another one. Again, you can pause and break the word down on your own, and I will work with you on the next slide. Again, you don't have to know the meaning of all the words right now. Just let's practice breaking it down. So you go ahead and pause, write the word cardiologist on a piece of paper and break it down. What's the suffix? what's the root word, and I'm sorry, I apologize. What's the prefix? What's the root word? And what's the suffix? Okay, hopefully you had an opportunity to break it down. So let's decode that together. Cardi is the prefix. Is the combining vowel. So it's just, we put that, I guess, as the root word. We could. And then logist is the suffix. Cardi, logist. Okay, so what does it mean? Cardi, we already said, means heart. So this person is coming into the doctor because something's going on with their heart. The the O or whatever is nothing. It's just the letter that's connecting, right? The prefix and the suffix in this example. Logist, what did we say logist was? That's the specialist, the person, right? So cardiologist is a person or a specialist who treats what? The heart, right? Cardiologist, a person who treats the heart, or a doctor, right? And so here are some examples, right? You see these fine young black men who are doctors, and they are treating the heart of their patient. They are then cardiologists. That's their profession. Okay, your turn again to pause and practice. Term is endoscope. So go ahead and write it down on a piece of paper. What's the prefix? What's the root word? And what's the suffix? Okay, hopefully you had an opportunity to do that. Let's do it together. Endo means inside. And again, I didn't expect you to know that, right? We're going to just keep doing this and you'll learn it over time. So endo is inside and scope, right? So it's just endoscope, those two words. So the root word is scope. You don't have a suffix on this one because it's a smaller word. But endo, end, right? Endo. Endo is inside. Scope is an instrument used to view something. Again, I gave you the example of a telescope. You're looking through that hole to see something on the other side. And so what does this mean? Endoscope is an instrument used to look inside the body, right? Telescope, we might be looking outside and looking at the stars, but when you are a healthcare profession, you're going to always think about this. Okay, how does this relate to the healthcare profession, who I am in my career? So endoscope is you're going to look inside the person, right? Why? So you can see what's going on in a way that you can't see by just looking at them, right? Just looking at the person in front of you. You're going to use this instrument to look inside. So here's an example of how that happens, right? So here are the doctors or the nurses or the staff. They have the endoscope, which is that tool in his hand. He has poked that inside of this person's body. And now on the screen, it looks like maybe a heart. They're able to see that person's heart, right? So endoscope, a scope inside of the body to help them see what's going on. Okay, let's keep moving. Again, your turn. Go ahead and pause the video and give it a try. Hypoglycemia, right? Hypoglycemia. How would you break that down? Prefix, root word, suffix. I'm not asking you to understand what it means. I'm going to help you with that on the next slide. So you just break it down right now and meet me on the next slide, Ariel. Okay, let's do it together. Hypoglycemia. Hypo means below not below number, I'm sorry, below normal, under normal, low, right? Glyc is sugar. It references sugar. And emia relates to blood, right? So hypoglycemia has something to do with low blood sugar, right? So if we just put all those clues together, well, something is low. It's the sugar level, which is the glyc or glucose, and emia is blood. And so you'll learn that emia means blood. Over time, you'll learn that hypo means under normal. And over time, you'll understand that glyc means sugar. So low blood sugar. Someone is coming in because they have a low blood sugar count. And this is what blood glucose levels look like. If it's low, there's not as much blue particles. If it's normal, you see some blue particles, but if it's high, that means you see all these blue particles. And a person who has high blood glucose levels mean that they're not, typically it means that they're not eating well. They're eating a lot of junk food, a lot of carbohydrates, and it's just not doing well inside of their body. So then they have to come to the doctor and maybe undergo a surgical procedure to get that back right. Okay, Ariel, this is the last one. Go ahead and give it a try. Again, at any time throughout this lecture that you need to like stop and take a break, feel free to do that. This is no pressure, right? Just take your time and we're going to get through this together. But when you're ready, go ahead and tackle this last term, this last example. And the term is intravenous. Intravenous. So again, see if you can break it down, the prefix, the root word, and the suffix, right? Beginning, the root, and the end. And then meet me on the next slide. Okay, let's do it together. Intravenous. Intra, well, it means enter, within, inside, right? So you see how I'm using these words like intra, inside, enter. So that's enter. Ven is vein. Us is just pertaining to, right? So some of these parts is just, okay, it's just pertaining to that. So when we put it together, intravenous means inside what? The vein. How do you go inside someone's vein? Typically with a needle, right? So it's pertaining to within the vein. And here's an example of intravenous procedure is when you go to the doctor and you have to get blood work done, someone is going to take a needle and go inside the vein, intravenous. All right, we made it through that last example. And so just wanted you to know that, again, you don't have to memorize all of these parts, the prefix, the meaning, and the example, right? So there, I put together a cheat sheet for you, and it's available for you inside of our Google Classroom site. So this is just giving you some examples of prefixes, right? The pre or before part of the word, and you'll see some of these peri meaning around, intra within, sub under, hyper excessive, right? So you can think of a hyperactive kid, they're excessively moving around, hypo below. So again, when you're trying to learn these terminologies, just link it to something you already know and it'll help you to remember it later. The next slide. Now here are some root words that you might come across. Again, derm is skin, cardi, heart, like cardiac arrest. Gaster is stomach, neur is nerve, and arth is joint, like arthritis. Again, don't remember it. I'm just kind of going over it. Here are some suffixes or end of the word is itis, inflammation, ectomy, is a surgical remover. Ectomy, like a bisectomy, you're taking something out. Bisectomy, you're taking out the man's ability to create a child. Scope is the instrument that you view something through. Osis is condition. And logi is the study of like biology, psychology, right? Again, don't worry about it. I just went over it briefly. There's a handout for you in the Google Classroom. Okay, so I'm at the end of this lecture, Ariel, and I want you to know that with this lecture, and as we move forward with the course, you're learning the language of healthcare one step at a time. Don't be in a hurry. Don't stress yourself out. I really want you to have fun with this experience, knowing that you're setting yourself up for something bigger and better in your life. I want you to know that every word you break down or break apart, it helps to build your confidence, right? It's going to help prepare you for your career as a sterile processing program technician. So take your time, trust the process, and remember you are training your brain to think like a healthcare professional. It takes time. You got to reprogram that brain, right? And so the activities that I present to you are going to help to build your self-confidence, your self-esteem, so that you too can see yourself as a professional in the healthcare field. All right. I love you so much. See you next time, baby.